Hello, welcome everyone. This is Chinyere Eze of Eze Health Center. We are broadcasting our first official webcast. This is our new normal now of doing our nutrition series. We are happy to have a special guest with us today, Lisa Hugh of Southern Maryland Dietitian. We will be discussing nutrition for immunity, which are keys to prevention. So our talk is going to be very kind of casual today. It's more of like a discussion. We're also opening the lines up for any questions that you may have. But this is a very important topic, especially considering what's going on with the coronavirus and how it's impacted our lives in so many ways. And I'm just really happy that Lisa can join us. She is a dietitian, and she is the primary dietitian for Southern Maryland dietitian here in Waldorf, Maryland. She specializes in complex nutrition needs, including food sensitivities and advanced nutrition testing. Her practice is known for really working with people as individuals, helping them with what they want to work on, with the understanding that no two people are the same. What works for some may not work for everyone when it comes to diet. She strongly believes that changes in nutrition can help everybody get healthier and look and feel their best. One of Lisa's specialties is working with busy people who have some ideas about knowing what to do, but haven't figured out how to do it. I would like to introduce you to Lisa Hughes to our webcast.
Hi. Thank you. Thank you for having me. I'm glad to do this webcast. I think we had great experiences in your office, and now we're pivoting online, and I think it's going to be great for all the viewers. So thank you, everybody, for joining us today.
Absolutely. Now, Lisa, you have been a tremendous, resource for a lot of folks out there, especially when we've had our presentations here in the office. You've been a great resource in giving guidance in regards to, what are the right moves to make with nutrition. And one thing that I really like about your approach is that you make it very individualistic. What works for one person may not work for another. Now that we're talking on the subject of immunity, obviously all of us as humans, we have an immune system that's innate, that this is our body's natural defense mechanism against disease and common ailments and antigens, things like bacteria, viruses, etc. So a lot of times people don't think of the nutritional component of that, right? When it comes to having a healthy immune system to fight against illness and disease. So with all that's going on with the coronavirus, a lot of people have, some concerns and, questions about how can they best protect themselves to keep from actually being exposed or potentially contracting this very deadly virus. So with that said, I wanted to kind of get your insight on, overall, what are some main nutrients that we need to think about when it comes to supporting our immune system?
Yes, we can definitely. I think what you said is really important, that people are now starting to think about nutrition related to the immune system, or maybe they weren't thinking about it before. But from my perspective, nutrition is really fundamental to our immune system. It's not something that really can be ignored in any circumstances. And I've seen this in a lot of different circumstances. Even working with viruses, like a while back, I worked with a large HIV population, and the nutrition care was one of the main aspects of their care. Even though the people had already contracted this virus, having a good nutritional status helped keep their body healthy and prevented some of the worst complications. So I think thinking about COVID-19 and other illnesses, definitely prevention is best, but also thinking about, if we do contract an illness, can our bodies handle it? Can our bodies keep us healthy rather than succumbing or getting long-term side effects? But definitely thinking about what nutrients are important. The easy answer is all nutrients are important for our immune system, but specifically we need to make sure we have enough protein, enough vitamins, enough minerals. And like we talked about in a lot of the classes before, having a well-balanced diet is really fundamental to that. So generally, when we have a well-balanced diet that has a protein source, complex carbohydrates, and is high in fruits and vegetables, we tend to get most of the nutrients that we need.
Right, absolutely. So I understand that, say, and this is something that I've seen even with a lot of my patients where they haven't really had the most healthiest and balanced diet, being indoors a lot more. I mean, now we are starting to reopen a bit, but for the past several weeks, um, people haven't really been making the best nutritional source choices. And going more towards the stress eating and the foods high in sugar and salt and preservatives. I mean, are there particular foods that can actually kind of worsen or depress our immune system, or cause us to be more prone to, getting sick or ill?
Yeah, I think that in a couple different. So if somebody's eating a lot of processed foods, those foods end up crowding out the more nutritious foods. So it may not be that those specific foods are causing an illness or causing a poor immune system, but they're replacing foods that we need to have the strong immune system.
Right.
That's one area. The other area is if people are eating foods that kind of don't agree with their bodies, if they're having food allergies or food sensitivities, the immune system gets stirred up and is fighting basically the food that we're eating, and it's not doing its own proper job. So that's definitely another area of nutrition in the immune system. And then the other aspect is mainly dealing with blood sugar. So if people have diabetes, pre-diabetes, or high blood sugar for any reason, anytime we have elevated blood sugars, our immune system really suffers. So those are the main areas that I look at in terms of things that we should be avoiding.
Right. And so what we're seeing now with a lot of the reports is that a lot of the individuals, unfortunately, who are contracting and eventually even passing away from the COVID-19 disease do have what we call comorbidities or other chronic illness and disease along with, contracting the virus. So there's higher rates of mortality or deaths among individuals who have conditions like heart disease, diabetes, obesity. So we're finding more and more that, having these other chronic illnesses and comorbid conditions can in fact increase your chances of dying from this illness. So, that just you mentioning that, elevated blood sugar or glucose levels can actually make you more prone to possibly worse outcomes when it comes to infections is very relevant.
Yeah, absolutely.
Mm-hmm. Yeah.
And I feel like conditions like heart disease, we might not think that eating a heart healthy diet is really specifically good for our immune system. In short term, that might not be the most focused strategy, but in the big picture, having good nutrition all the time, even when we're under times of stress and staying home, is really important to kind of attend to our overall health, preventing chronic diseases, taking care of any illnesses that we have currently, and not putting those kind of on the back burner.
Absolutely, I agree. And it's good that you mentioned that it's much more than just the nutrition element of it, but what are the other lifestyle factors that are to come into play? It's very important that, we get enough sleep. That's when our bodies are able to restore and replenish itself. So it's absolutely vital when it comes to your immunity. In addition to that, making sure you're well hydrated, drinking plenty of water. Again, this is something to keep us overall very healthy. Stress management, and that's something that I definitely talk about a lot in my practice, is getting stress under control. And believe it or not, proper nutrition and exercise and proper sleep actually are the elements that help reduce stress. So knowing what things that could actually be bad for our overall health is bad for our immunity too, and can make us more prone to serious infection. So, there's a lot of things out there that, we read and see on social media, different cures and supplements and all these other things out there that, that these companies advertise saying that, oh, it can prevent you from getting coronavirus, or it can, cure it, and there's a lot of, misinformation that's out there. And it's scary because unfortunately it misleads a lot of individuals who may not know and, think that they're doing something that's going to keep them from getting the virus when in fact it's not adding any additional benefit to them. So what are your thoughts on, what are some, dispelling some of the myths and misunderstandings and misconceptions about what are, the essential vitamins that your body needs for immunity.
Yeah, that's a really good point. It's really important to look at supplements for what they are. They really are to supplement our good diet, our good healthy lifestyle. They're not a replacement for a poor diet. But that said, I think that supplements can be used safely and effectively to keep us healthy. And sometimes I think certain supplements are sort of so common that people don't take them seriously. So, for example, I see a lot of people that have vitamin D deficiency, they have anemia or like a borderline iron deficiency, and they sort of accept that as, oh, I just have this low vitamin D, and they think that's sort of normal for them, when in reality, that's a condition that can be easily treated, through supplements that are generally safe as they're working with a provider, and that can help their immune health tremendously. So I think taking more of kind of a common sense approach to these supplements is needed versus, what I see in practice is people sort of either ignore these concerns or they tend to go overboard and they want to take a lot of supplements. They're doubling up on supplements. They're taking super high doses and they might be experiencing side effects from those, or they might be supplementing but not having a healthy lifestyle, not sleeping, not addressing other medical conditions. So they can be kind of causing more harm than good.
Right. Yeah. And that's something that I see a lot of in my practice as well, where, they they bring in multiple bottles of different supplements and vitamins, and yet the diet's not so good, or they're sleeping 2 hours a night. And it's like, well, the supplements aren't really going to do much for you unless you got all these other things in order as well. So knowing what are kind of the more essential vitamins that our bodies need, in addition to the lifestyle changes and things that we need to do to keep our bodies healthy. So, there's a lot of things over the counter, as far as immune boosting vitamins. So you've heard of Emergency or Airborne, vitamin C and zinc. What's your outlook on, what are the best quote unquote immune boosting supplements that we should be taking?
Absolutely. Generally speaking, I think it's safe for most people to take a multivitamin, a vitamin D supplement if they need it, and probiotics as just sort of baseline supplements to kind of make sure that our diets aren't missing anything. Some of the other specific immune boosting supplements can be beneficial short term, but they're really not intended to take every day for a long duration. Sometimes high levels of vitamin C can cause stomach upset, can cause diarrhea. Some people are prone to kidney stones or similar conditions, and the vitamin C might be too much for their body to handle in that case. And then any supplements that contain zinc are not really intended to take long-term. Those are usually 14 or 30 days. Taking zinc longer can actually interfere with our iron absorption. So that could create its own host of problems. So really these things have to be taken, with caution and strategically, and not just sort of more is better doesn't work in this situation.
Right.
Yeah.
So,
also, I've seen a lot more interest in elderberry and some of these other plants and herbs that boost the immune system. And I definitely think there's a lot of potential for those to be helpful. But sometimes kind of the risk is they stir up the immune system a little bit too much. And then there's some concern that if people have an infection and their immune system is activated and their body's going through inflammation, these can actually cause more inflammation at times, which would be a negative. And I've also seen it when people are taking a lot of elderberry. Sometimes that seems to make allergy symptoms or eczema symptoms worse.
I see. Wow. So in your practice, is for instance, nutrition testing something that's routinely done? And if so, are there particular individuals who would need to get nutrition testing as opposed to others, or what's your approach on that?
Yep. So currently I encourage people to work with their primary care providers and do a full set of labs that can be done through their insurance to kind of pick up on if there are concerns that we have to dig into deeper. But generally, looking at labs that check for inflammation, like cardiac reactive protein, homocysteine levels, those can be helpful to give us an idea of if the body is sort of inflamed or not. And then also looking at iron levels, vitamin D levels, some of the B vitamins can give us big clues. And then the more advanced testing can be a more in-depth micronutrient test or food sensitivity testing or food allergy testing to tell us more what's going on.
I see. So should the average kind of healthy person get a nutrition testing done, or is it more so for individuals that have particular chronic disease or illness? What would your approach be to that?
Yep. Usually I don't recommend those in-depth testing straight off the bat. I sort of use that routine medical testing as a screen. Mm-hmm. And then if more testing is needed, we can do that. But definitely some people are just really interested and they want to dig in full force. So they definitely have the option for that as well.
Gotcha. So yeah, again, going back to, thinking about what vitamins and supplements need to be taken to help support the immune system, understanding overall, and I didn't get a chance to really mention this earlier, is how does our immune system work in general? What are the components of our immune system? Well, we have certain elements, a lot of different elements of our immune system, and believe it or not, part of that is our skin, which is the largest organ of the body, is the skin that creates a physical barrier to any outside bacteria or germs or anything that we may come in contact with. The most common entries of antigens or anything that could cause an infection is through our nose and mouth. And in the digestive system is where you're going to find the most active parts of our immune system for that very reason. So you have your lymph nodes, you have certain organs in the body, the spleen, the white blood cells that circulate in your bloodstream. These are all parts of our immune system to help really fight any ongoing infection. So with that said, and knowing that, a big portion of our immune system is in our gut, in our digestive system, we hear a lot about probiotics and how that may be helpful. Give us some of your thoughts on the use of probiotics.
Absolutely. People tend to do very well taking probiotics or eating foods that have other healthy bacteria in them. But for the most part, probiotics work on helping us to break down our food, absorb nutrients, keep our intestinal cells healthy, help us regulate our hunger, our mood, our digestion. So probiotics are a fantastic thing. There's a lot of popular brands that are over the counter that people do well with. But it is important to know that some strains are designed for different things. So some sort of boost respiratory health, some boost more like mood and the brain function. Some tend to boost functions related to controlling constipation or diarrhea. So different strains of probiotics do different things. Mm-hmm. And that's really something I work with people on individually. If the more general products are not working or not giving a good effect, we can get more specific with that.
I see. So in general, would you say that the average healthy person with maybe not any major medical issues or chronic illness or disease, what are the essential type of vitamins or supplements that they should be taking? Should it be like a multivitamin, probiotics, more individualized? You see advertised the men's multivitamin and women's multivitamin. So kind of differentiating, what would be the best course for the average person to take in regards to getting that the essential vitamins and supplements they need.
Absolutely. I think it's important to take a multivitamin on a general basis, because even when we think we're eating well, if we really assessed our nutrient intake, oftentimes it falls below the recommended levels of what we should be receiving. So women's multivitamins are designed that they have iron in them, whereas men's multivitamins don't. Mm-hmm. Some different products have a lot more enhancement. So it might be a multivitamin with specific herbs or plants to give different benefits. So those things should sort of be considered on a case-by-case basis. A lot of people are generally healthy, but they might have some constipation or upset stomach. So that could be a clue that taking the probiotics would be a helpful thing. People don't have to be extremely ill to benefit from these products.
Right, I see. So in general, we should at the very least be on a multivitamin for the most part. It doesn't hurt, right?
for most people, it's not going to hurt. I would say probably for 90% of my patients, I recommend them to take a multivitamin. There are there's individual cases where that's not a good idea, but usually people have received pretty clear instructions from their healthcare providers, like don't take any extra supplements, don't take any vitamins, if there's a reason for that.
I see. So what is your thoughts on herbal supplements? I know, you mentioned the elderberry earlier, and a lot more individuals are wanting to do more of the herbal natural supplements as opposed to other things that may have a lot of, like, for instance, fillers that don't really do a whole lot. So what are your thoughts on like herbal supplements in particular?
I think people need to really think about what the product is and what's the reason for taking it. And then just because something is healthy or good for us doesn't mean that we need it at that time. So some of these herbal products, they're meant kind of for a general daily supplement, and some can be okay, but some are really intended to be a treatment for a condition or a treatment for a symptom. So if you're not experiencing that symptom, it might be more than what you need, or it might have side effects that kind of outweigh the benefit you're getting at that time.
I see. So I think it's very important that we also let, our audience know, if you are choosing to take a vitamin or herbal supplement, it's important that you let your medical provider or healthcare professional be aware of that. Even though it's not considered a medicine, it can potentially interact with any prescription medication or even other vitamins and supplements that you're taking. A lot of times there's a misconception that, oh, it's a vitamin, it's healthy, it's not gonna, cause any harm or issues, where in fact, if it's, like you mentioned earlier, if certain, vitamins are taken in excess, or if there could be a potential interaction with a prescription medication or other vitamin or supplement, it could be very problematic. So, so that's one.
I see that frequently. People take magnesium sort of for body pains or migraines or for sleep, but it can cause diarrhea. Or a lot of supplements for diabetes and blood sugar control have cinnamon in there, which can be, a very good effective supplement, but it does have the potential to interact with other medications. So communicating with your healthcare provider is definitely required then.
Yeah, very, very important. So was there any kind of other information that you feel that would be useful for our audience to know about nutrition and immunity in general?
Absolutely. I want to share that one of the main things I'm working with my clients on, it definitely ties in what you said earlier about sleep, good nutrition, stress management. But I think right now, when all of our routines are really disrupted in one way or another, we have to really be strategic about our routine, knowing that we're going to bed at a certain time, that we're sleeping a certain number of hours, that we're having set meal times, that the meals are really balanced meals, that we're scheduling exercise every day, and not sort of going by our feelings, because feelings are really sort of mixed up right now. And if we're waiting like, oh, when I feel good, I'm going to exercise, that probably is not going to happen under our current situation. So I think being really strategic in our schedule will allow us to have that good nutrition, that good stress management. That way we can sort of identify what areas we need to work on, what's working well. But that good schedule really helps everybody.
Absolutely. I 100% agree with that. Taking those small steps to, get healthy, trying to totally revolutionize your entire lifestyle overnight, it doesn't happen. It just, it's very important that we just take these small steps towards better health and start right now. It's not something that, you have to wait until the first of the year or first of the week or first of the month to make, take these initiatives and steps. I'm a big believer in doing a right now resolution as opposed to a New Year's resolution. There's no moment like the present moment to get started with just living a healthier life. Okay. But thanks so much, Lisa. I really appreciate you taking the time with me today to, share some information with our audience. If we have any questions, also, I forgot, if we have any questions, certainly our audience is free to type that in. I don't see any coming in quite yet, but certainly if it's okay, Lisa, if I do get any questions kind of after we get off the broadcast today, Is it okay if I kind of send that over to you and then maybe connect you to some individuals that might have some questions for you?
Definitely.
That's fine. Okay. So if you could just share with us how we can reach you, how clients can potentially schedule an appointment with you, even if they do need some nutritional counseling or guidance. And I understand you do virtual visits as well.
Mm-hmm. Yes, I'm doing virtual.
Excellent. Excellent. So is there a website or Facebook page or anything that they can go to?
Yep, the easiest thing is just to go straight to my website, southernmarylanddietitian.com. There's information on this site about the virtual appointments. There's information about insurance coverage. I participate with a lot of insurance plans, so most of my patients don't have any out-of-pocket expenses right now. And actually, insurances are generally waiving copays right now, so now's a really good time to sort of dig in and work on some goals and get some individualized help.
Absolutely. Well, thank you so much, Lisa. I appreciate your time, and hopefully we'll be able to do this again. This was great.
Have a good evening.
All right, you as well. Thank you. All right, bye.